there will be a chance of getting some other events like other effects, like whenever you are taking the paracetamol or any other drug, there will be a chance of getting some dizziness. So we didn't expected the dizziness, but it is the drug is causing the dizziness. The dizziness itself is called as a side effect, other adverse events, which is untoward response. You are taking the drug with the intention of treating something, and along with that action, you are also getting some other action. So in such cases, that type of a reaction is called as a adverse effects. The pharmacovigilance completely deals with the this type for detecting and assessment of these type of action side effects. Okay, so this is the pharmacovigilance. So we will we will know about we will get the definition. So drug safety is also known as a pharmacovigilance, is the pharmacological science relating to the collection, detection, assessment, monitoring, and prevention of adverse effects with pharmaceutical products. Exactly, this is the definition. So what they are saying in the definition, we can observe that this is the pharmacological science. Pharmacological in the sense, completely the pharmacology deals with the completely actions of the body to the drug and drug to the body, like a pharmacokinetic information and the pharmacodynamic information. We know that the pharmacokinetic information is what the body does to drug. When we are taking the drug after release after entering into the body, it divides into some particles. It is going to disintegrate into smaller particles. After disintegration, it gets diluted into the fluid and it gets absorbed from the intestine to the blood. After entering into the blood, it reaches the systemic circulation, then it gets metabolized and it converts into active form, and then it shows its action. So whenever it converted into the active form, along with the therapeutic action, it is going to show some unrelated and untoward responses. So whatever the responses the drug is giving, finally giving, just we are going to collect all the information. So that pharmacovigilance completely collects that and detects and assesses and it does assessment of that particular information and monitors the thing and prevents these adverse effects. Okay, whatever happening with that pharmaceutical products. So okay, then we'll move to the next slide and we can say some introduction like a adverse drug reaction. We don't know what is adverse drug reaction. Adverse drug reaction. Adverse in the sense which we didn't expect. That means we are taking the paracetamol with the intention of treating the fever. Okay, it is reducing the fever, and along with that, and I said that some it is causing some nausea, some vomiting type of effect. We don't want that effect, but it is showing that type of such type of effects. So we can say we can take this nausea and vomiting as a side effect, adverse effect. Untoward medication. Your drug with it is taken with the intention of the curing that fever. Along with that, it is giving the side effects like nausea and vomiting. That is untoward. That is not related to the treating that particular condition. Additional to that, it is causing. So the additional information, that means the untoward response to the pharmacological action, that is called adverse event. Okay, as a definition we can say that an adverse drug reaction caused by taking a medication. In classification of various adverse drug reactions, we know about different types of adverse drug reaction and its effect. So these adverse drug reactions completely caused due to the medication consumption. After taking that, it will give therapeutic action, along with that some untoward response also it is going to give. These untoward responses will be classified as adverse drug reactions. So in next sessions we will get complete information on these adverse drug reactions. Primarily, so we need to have some idea. That's why I'm giving what is adverse drug reaction. You are taking this as a simple, we can say that we are taking one drug with the intention of treating one particular disease condition. This is the adverse event. You are taking with the intention of treating but one particular condition. So along with the drug is treating that particular condition, but along with that it is causing it is showing some any other effects like nausea, vomiting, dizziness. So this untoward responses, unwanted responses will be called as a adverse drug reactions. Why I am stressing this adverse drug reaction, adverse drug reaction is the main thing, the pharmacovigilance system completely related to these adverse reactions of it. So, what is pharmacovigilance? Already in previous slide, I already said that this pharmacovigilance is a pharmacological science relating to the collection, detection, assessment, and the monitoring prevention of adverse events with the pharmaceutical products, right? So, how this pharmacovigilance is acting? The pharmacovigilance department will monitor the drugs. So, first suppose that new drugs are coming into the market. We don't have all the complete information about the drug. So, the drug which are in clinical trial, we don't about the complete information related to that particular drug. So, initially we are gathering the information. So, while we are gathering, we don't know exactly. Maybe we are expecting some therapeutic action from the drug, but we don't know. Either it is going to show some adverse events, some side effects it is going to, we don't know. First of all, we are monitoring. Firstly, we are trialing the drug. Firstly, we are getting the data. At this point of time, someone have to take care about this safety. I mean, safety data that means adverse events and the side effects. Someone have to take care. Exactly, the pharmacovigilance department is going to take care of these side effects. They are going to monitor this drug for that particular any other side effects along with the therapeutic effect. Okay, this is the new drug, it is causing side effects. So everyone is observed that the drug is causing some side effects. The pharmacovigilance department came to know that the drug is causing some X side effects, some Y side effects, some A side effects, some B side effects. Okay, they monitor that. What they are going to do? They will capture that information and they are going to code it. Coding means something happens, some medical technology, some medical condition of a patient, some medical condition of the person, any situation happens, that situation or the condition will be coded into numerical, which is acceptable codes. That is medical coding. By the using of the codes, just they are going to give the situation information with the code. They will code it according to the situation, according to the condition, they are going to code it. After that, they will assess it. Why these side effects are coming? What is the reason? Is that new drug is really reason for the side effect? Or any other food effect? Or any other medication which is taken as a combination with that drug? They are going to assess it. And finally, they are going to understand what is exactly the reason is for. Sometimes, if you are trialing a new drug, maybe that is not related to the something, some side effects are going to happen. If the side effects are happening, it is not like that completely the side effect is related to this new drug. There may be chance of these side effects may be happening due to any food habit, food effect. The person is having consuming the alcohol is a habitual of alcohol because consuming the alcohol only while he is on that particular drug shouldn't have. I mean, he is going to take the alcohol because of taking alcohol only. This thing happened. So such cases, the drug is not responsible for the side effect. The alcohol consumption is the responsible for the side effect. Then the side effect is completely not related to the trial. They are going to assess it, they are going to understand it like that. Now, if the drug showed some side effect, the side effect is completely related to the drug, then we have to report it. So, some responsible person to some responsible person. How we are going to report it? Just if you are going to report the thing to the Indian government, serious CO is the responsible thing. The pharmacovigilance. If you are a person, you are a educated person, you are a qualified person, like a qualified pharmacist or a qualified medical person. So if you came to know that the drug is causing some serious side effect, in such cases, just you can report it. Now, to report that particular event, you should have, I mean, you have to produce in a particular way. You have to produce it in particular format. If you are submitting it to the Indian government, you have to submit it in a format. The Indian government will give you some format to report some adverse events. You have to, at any cost, you have to report in that format only. And one more thing, if you are going to submit to the the US FDA will give some regulations and some format they will give you. You have to report in that format only. Then only they will accept it. And after reporting, you are going to communicate. Okay, so why it is happening? You are going giving by communicating, you are going to give some more information to them. Okay, so with the pharmacovigilance department, what exactly they are going to do is, so they will monitor about the drugs, pharmaceutical products and the pharmaceutical drugs. They will observe regarding that pharmaceutical products and the drugs. If they find some say something like some adverse events, something medical conditions are occurring, they are going to, the situations will be coded into particular code format. They will make into code format and they will analyze it. They will understand why if it is it completely related to the trial drug or it is not related to the trial drug, related to the food effect. They are going to assess it. They are going to understand it. They will come to a conclusion. If the drug, the side effect which is observed by the pharmacovigilance department is, if it is really because of the new drug, they are going to report it. We know that the clinical trials are going to conducted into a particular area, then you have to take the permission from the local areas like our local IRB, institutional review boards, and the independent ethics committees. These are local organizations who are going to monitor the things. So you are going to report that particular thing to the local organizations and the local regulatory bodies. Okay, you are going to communicate, and by communicating, you are going to provide much more information. So before going to that, before going to deep, just I'm giving a small information, like our clinical development of medicines, how the drugs will be developed, how these drugs are developed, and we are developing a new drug. So we don't know about the drug completely. First time we are preparing the drug, we are gathering the information related to the drug. So to bring one new drug into the market, it had to undergo so many trials. So initially, the research, I mean, you will do the research, laboratory research you will do. You will find out a molecule. That molecule is having some medical therapeutic effect. You found that if suppose some X, I'm the Gopal, I invented a new drug that is curing the cancer. Now, I am expecting the drug is curing the cancer, but I have to prove. I need proof. If I'm going to share the information, are you going to trust it with my words? Are you going to resist? No, no one going to trust. Everyone needs the proof. For that purpose, I am conducting the animal experimentation. I am doing the animal experimentation. Okay, this animal experimentation and laboratory experimentation to collect the pharmacokinetic and the pharmacodynamic properties. As I said, so every day after entering into the body will act on the drug, and after that, the drug will act on the body. Like the pharmacokinetic and the pharmacodynamic action will be offered with the drug. So primarily, we need to get some information related to that before going to trial the drug on humans. So for safety, we are conducting it on animals. We are doing the animal studies. We are giving the same drug to the animals by calculating the body weight and all. We'll give the drug to the that animal, and we will give the preliminary. We will gather the preliminary information. We will look for the efficacy. We will intentionally we will create. I mean, we will give the cancer causing cells to the animal, and we will gather that information. After doing that, we are going to gather the information. If the drug is really curing the cancer, then we are going to use it for the cancer. Okay, so we are doing the preclinical studies. That means animal studies. Before going to clinical studies, we will conduct the animal studies, and we will get some information. That information will be submitted to the FDA. So why we need to submit that information to the FDA? We have to submit that information to the FDA for requesting FDA to give permission to test that particular drug. Whenever you are giving that, whenever you are getting that approval from the FDA, what you are going to do? Definitely, you invented cancer-related drug, right? So whenever you are testing the drug, when you invented the cancer-related drug, then you have to test the drug on cancer patients. So then you are going to look for the cancer patients. Where will be the availability of the cancer patients? Definitely the availability will be in cancer hospitals. Now you are approaching to the cancer hospitals. The person who is treating that cancer patient, cancer therapist will treat. We are going to communicate with the cancer therapist. We are asking him to participate into our trial. So we are requesting, we are sharing our research information with the that particular cancer therapist. We are selecting him as a PI, principal investigator. So we are recruiting him, and we are going to give complete research information to that particular principal investigator. What he is going to do after entering into our trial, he is going to test our new drug on his patients. The testing will be done on 4 phases. That is a phase 1, phase 2, phase 3, and phase 4. So in phase 1, what exactly we are going to do in phase 1? In phase 1, we are going to test the drug on 10 to 20 to 50 healthy volunteers to gather the preliminary data. That preliminary data completely involves pharmacokinetic and pharmacodynamic information. So again and again I am saying that. So you will get the preliminary data. If also you will look for the safety and efficacy of the drug, safety and potentially harmful side effects. You are looking for the side effects. From first phase onwards, you are looking for the side effects. As you can say, the clinical research and the clinical data management involves complete data capturing, but pharmacovigilance doesn't. The pharmacovigilance department only looks for the safety data. That means adverse events, serious adverse events, side effect data. They are going to only capture this data. In phase 1, they are going to test that particular drug in limited number of patients. That is a healthy volunteers. They will get a preliminary data, pharmacokinetic and pharmacodynamic information. They will look for, along with that, they are going to looking for the side effects, potentially harmful side effects. If in phase 1 itself the drug is showing any harmful side effects, definitely your trial is not going to proceed. Okay. So if it is not showing any harmful side effects, definitely your trial is going to proceed for the phase 2. In phase 2, you are going to conduct, you are going to conduct this clinical trial on 150 to 350 subjects who are suffering with that particular disease. Okay. So you will gather the information from these patients, like efficacy. If the drug is really treating the thing or not, you are going to gather such type of information in phase 2. In phase 3, you are going to conduct this clinical trial on 250 to 4,000 patients who are having, who are suffering with the disease. to determine the short-term safety and the efficacy. In case of the phase 3, you are doing that after and one more thing. So whenever you are conducting the phase 3 trials, that will be you are conducting the large population, thousands and thousands of people, and thousands of people you are conducting. So whenever you are doing that, one patient will respond like something, one will give some response, one will give some other response. Like he was one person will say that the drug is acting very good. One person will say that it is not acting. So some person will say, okay, it is fine when compared with the previous drug. Like that he is going to go. So which one is the correct one? We don't know. So to avoid that type of a situation, we are conducting randomized and blinding studies, so which we will cover in our sessions, next session. And after avoiding that complete, bias, that means confusions, by doing the randomization and the blending of the studies, we will get the accurate information. After getting that accurate information, the data will be submitted to the FDA, and then we are going to get the approval. If the data satisfies the FDA, then we will get the approval for the marketing our drug. We will register our drug and we are going to market our drug. What is this phase for? Already we registered, we completed our registration process. We can sell our product. Why we need to conduct this phase for? So after entering into the market, the drug may or may not show the side effects. On long-term use, cancer is the very acute chronic disease. So it needs long years and years of the medication. On long-term usage, it may cause any side effects. Like our NIM slide, on long-term usage, it caused renal damage. Recently, they have banned in the India also. So the drugs after entering into the market 20 to 25 years, the regulatory bodies are going to monitor for the side effects and the adverse events. So after monitoring, if the drug is really giving any side effects, any other adverse events, the drug is serious adverse events, then the drug is going to be recalled from the market. That is called FDA recalling. That's why the phase 4 trials completely termed as post-market surveillance studies. Okay. Then, if the drug found something, it is causing some adverse events, then we have to report those particular things to the regulatory bodies. So this will be done by the pharmacovigilance department. The reporting will be in many ways. It's like a spontaneous reporting. If the drug is causing any serious harmful effect like a death, sometimes it may cause death. There is a serious adverse event. In such cases, we have to report it spontaneously. We have to report it. At any cost, we have to report it immediately. Some guidelines will be there, some timelines will be there. I will discuss with you. And coming to the ICH GCP, whenever we are conducting the clinical trials, we have to follow the ICH guidelines, International Conference on Harmonization. So what is exactly doing? So ICH is bringing the US, Europe and Japan, these three countries together to discuss about the present aspects of the clinical research, and they will frame some guidelines according to that field. Why we have to follow the US, Europe, Japan guidelines? Their clinical trial guidelines are the standard guidelines which is accepted universally. They are maintaining good quality of it. They are conducting the clinical trials with good regulations, good principles. That's why we are bringing, the ICH is bringing these three countries together to discuss about the present scenarios of the clinical research industries and clinical research environments, and they are going to give some set of ethical principles to conduct the clinical trial. So why? To reduce unnecessary duplication and be contributes to the efficacy of the drug development and research program of unnecessary duplications. How? Through the development of the science-based international guidelines and standards. They are going to develop new standards and the new guidelines they are going to. Why? Why it is needed? To ensure the right safety and well-being of the trial subjects are protected. Why pharmacovigilance is needed? So whenever you are conducting the clinical trials, that should be related to the human health. Whenever one person is going to participate in the clinical trials, he will have some he will have some rights. Okay, we have to the safety of the person who are participating. That is also important thing. Well-being also. So to provide these rights and safety and well-being to that particular person who is participating in a clinical trial, we need that ICH. Someone have to take care about that. That the part will be taken care by the ICH in International Conference on Harmonization. What they are doing, they are bringing US, Europe, Japan together, and they are making something. Excuse me. Okay, so how we are going to do it? So every country will have one particular format. Earlier I said every country with a developed pharmacovigilance system has its own forms. CDS-CO. The India will have CDS-CO. They will they will have some form to submit the format. In that format only they are going to. We have to the Indian people. If you are going to submit that thing in India or Indian authorities, you have to submit in that form based on the CIOMS reporting form. So some different forms will be there, adjusted to the national legal requirements and the taxes. So the forms will be prepared according to the legal jurisdictions and all. So we are going to prepare and we are going to submit the forms as per the legal requirements and as per the requirements and form requirements. So we have to prepare in that format only. And the next thing, over you on the dictionaries, coding of the adversary, how you are going to code. After getting the report from the various sources, the information from an adverse event reported is coded using standardized technology from medical coding dictionary known as MEDRA, through which the information is really identified and analyzed. So the medical, we will get the sources. So paracetamol is causing something, diclofenac is causing something like that. We are going to get some more, lot of information. So after getting that information, an adverse event report is coded. The reporter is going to code that particular thing by using standard terminology from medical coding dictionary. So this METRA is the medical coding dictionary. They are going to code it, the particular condition, the particular adverse event, particular situation is going to be coded by using METRA, medical dictionary, through which the information is readily identified and analyzed. The information which is gathered from a source will be identified and analyzed by this METRA, medical dictionary. A is classified by the trials. For serious, the event should meet one or more of the following criteria. Adverse events. Adverse events. We are going to classify these adverse events. So how we are going to classify it? So the seriousness, depending upon the seriousness. So results in death. So if the person is going to die, if the person get died during the trial, that will be the results. So that is the serious adverse. Life threatening. Life threatening in the sense. Cause any damage like a loss of hearing, loss of eyesight, some other thing. Requires inpatient hospitalization and prolongation of the existing hospitalization. Requires inpatient hospitalization. That means you have to go undergo the inpatient. You are going to admit as a inpatient in the hospital. Results in persistent and significantly disability or incapacity. That may be there may be a chance of getting such type of thing. Results in congenital and anatomy, birth defects. That may be if the they are going to give the birth to the new babies. Definitely there are some anamorphic birth defects may occur. This type of a conditions will be called as the adverse events. The determination will be depends on the seriousness of the results. Resulting in death is a serious case. It ultimate. I mean that is going to peaks. The adverse events effect is at the peaks when compared with the results in the persistence of significant disability in earth incapacity. When compared with that, results in death will be the more serious. Okay. So let me just coding. How you are going to do? Coding is assessing the medical term to the adverse event. So you are giving one code particular A764. Maybe you are giving like that. Some medical, some adverse event is happening. For that adverse event, you are going to code it. Okay, by using Medra dictionary or WHO drug. There is also one dictionary. A narrative is a logical medical story containing details about it. The series of the things will happen for single patient at different and signal detection only. How you are going to do this detection? How these signals will be detected. The methods of data mining currently in use usually generate a score comparing. Just simply these are the score comparing. So that how the data mining will be done. The data mining will be done by two ways: observed reporting fraction and the expected reporting fraction. When the new drugs are going to take it, I mean, you are going to conduct the clinical trial on new drugs, the new drugs will be, I mean, you are expecting and some adverse events. Already you are expecting some adverse events that will be comes under the expected reporting fraction, and some you are not observing, but not expecting. You are not expecting that thing, but whenever you are conducting the clinical trial for such new drugs, automatically during the trial period you observed that thing newly, you found it. That will becomes under observed report action. Okay. Now the filters will be reporting year wise and the patient criteria, I mean characteristics wise. So going to the patient characteristics again it will comes under age and gender. Different filters will be there. You can filter that and you are going to mining, you're doing the data mining. We'll come to the conclusion. MHRA data is a stratified with the patient case. MHRA data mainly stratified with the this patient case filter. They use this patient case and they will stratify the data. MHRA. So these data overview on reporting timelines. So schedule Y, how you are going to report? Schedule Y, this is the Indian reporting. How you are going to report it in India? Only new drugs. For new drugs only we are going to report it 6 monthly, first 2 years, 6 months. For 6 months, for 5 or 6 months we are going to report it first 2 years. So first 2 years, that means you are going to first 2 years you are going to report it 4 times. That means every 6 months you are going to report regarding the adverse. Next subsequent 2 years will be submitted within 30 calendar days. For every 30 calendar days, for every 31 month, every month, we are going to report for the adverse events information. That means total 4 years. If you are calculating that 4 years, first 2 years you will be submitting for 6 months, 6 months, for 4 times. Then you will be the subsequent 2 years will be submitted in every month. In case of the EU, European requirements, even if not marketed, if the drug is not marketed also, if it is getting the adverse events, definitely that should be reported to the authority. 6 monthly, first 2 years. First 2 years, every 6 months, for every 6 months we are going to report. The annual subsequent 2 years at the first renewal and then 5 yearly at the renewal thereafter. So annually, first 2 years, 6 monthly, then subsequently annual, every year we will submit it, and 5 yearly at renewal. Thereafter, one PSVR for each active substance to be submitted within 60 days of last data lock. So if the drug is not marketed, the database is not locked. Then 60 days. Within 60 days, we have to submit the adverse events information. And the US will be having some other requirements like a pre-approval. PSUR 4 months after application, post-approval for each approved NDA, new drug application, ANDA, abbreviated new drug application, BLA, quarterly for first 3 years. For every 4 months, we are going to report in the first 3 years, then annual. After 3 years, we will be reporting annually. On request, within 30 days of the close of the quarter annual reports, within 60 days. So whenever the FDA asks regarding the information, just we have to report it. For first 3 years, we are going to report it quarterly. After that, we are reporting annually. If on request, we can produce in 30 days of the close of the quarter annual reports within 60 days. We are going to submit it. Okay, this is the formula. This is just an outline. So once we are started, means just we can go through the same components and briefly into each and everything, like what exactly we are doing, what is the what the software we are using, what is the adverse reaction, how the adverse event attribution will be done, the definitely, likely, like that will be there. So how they are going to monitor, how the coding will be done, so how they are going to understand, how the report will be submitted, how the clinical trial, what we are doing in phase 1, phase 2, phase 3. So what is ICH, human subject production guidelines. So each and everything we are going to know during this program. And the different reporting forms like US, Europe, Japan, USA, Canada, Germany. So for different countries, they will be having different reporting formats. So we can go with that formats. Okay. Now, coding, how we do the code, how the seriousness will be determined, and how we will do the narrative writing, how we are going to discuss during this period, and how the signal detection model, how we are going to detect the signal, how we will do the filters, how we will do the data mining, so, and how depending upon the country, how we have to submit the data, how we have to report the adverse events. So monthly, 6 monthly, yearly, 30 days on request, 60 days on request, how we are going to report it for each and every country. There will be some guidelines. According to guidelines, we are going to report the adverse events. These are about the pharmacovigilance. Hope you learned something. Thank you. Bye.
This is the course content that we will be covering during our training. Okay, so it's Pega 7 course content. So what I did is it's not just a CSA. Okay, so whatever the topics that are part of CSSA as well. Okay, so I just took those topics and even added it to this course content. So it's like at the end of completion of this course,